Hi, my name is Mark Wolf. I'm the Dean of the School of Dental Medicine at University of Pennsylvania. And I'd like to talk to you for a moment about dental care in the age of the pandemic, COVID-19. First, we know that dentistry is scary for lots of people for lots of reasons. But today, I'd like to help you not be scared about seeing the dentist when you are coming to see us here at Penn Dental Medicine. We'll talk about some of the things that we're going to do here to make you safe and some of the things we hope you will do coming to and from us to keep you safe. Wear a mask. It can be a cloth mask or a medical mask. The mask protects others from getting disease if you have it and you don't know about it. Masks will be required at all times in the School of Dental Medicine. Social distancing. Social distancing is making a physical space between yourself and the nearest person to you. Stay at least 6 feet from other people. Do not gather in large groups and stay out of crowded places and avoid mass gatherings, especially as people are eating, drinking, or talking loudly. Hand hygiene. You need to become concerned about keeping your hands clean. Wash your hands frequently for a minimum of 20 seconds. Use an alcohol-based hand sanitizer if you cannot get to a sink to wash thoroughly. When you use it, rub it generously around your hands after contacting any surface. Remember, do not touch your face, touch your eyes, your mouth, or your nose without sanitizing or washing first. We need to talk to you about teledentistry, or the telephone communication that we will have with you prior to you receiving dental care. 24 to 48 hours before receiving care, you will receive a phone call from us. We will ask a few questions. These questions are meant to find if you have or you might have the COVID virus, in which case we will defer your treatment and refer you to a primary healthcare provider. So we will ask if over the last 14 days you have had a fever over 100.3. Whether you've had a cough or a persistent cough, whether you've had a sore throat, shortness of breath, flu-like symptoms, muscle aches, chills, tiredness, diarrhea, recent abrupt loss of taste or smell, and last, we will ask if you've been in contact with somebody known to have the COVID virus within the last 14 days. If any of these answers are yes, it is best for us to defer your dental treatment until 14 days later to confirm that you do not have or have not picked up the COVID virus. If this is an emergency, we will arrange for care and we will manage your dental emergency. We ask you to be safe while either coming to the dental school or leaving the dental school. Please wear a mask, try and maintain social distancing, and most importantly, disinfect your hands frequently as you touch common spaces on a bus, at a bus stop, or opening a door. When you arrive at Penn Dental Medicine, things will look different. We will be seeing fewer patients so that there will be less waiting for you. We don't want you sitting in the waiting room with lots of patients around you. Social spacing. We will have additional cleaning staff cleaning the floors, the walls, the door handles, cleaning the tabletops and the seats you sit in. We will utilize additional infection control measures and different agents to protect you, our staff, and the doctors who treat you. This will include heavier duty masks so that If you should have the disease, you cannot give it to us, or if one of us were to have the disease, we cannot transmit it to you. We will have fewer seats in our waiting areas to encourage social spacing. We will greet you at the door and make sure that you're wearing a mask. We will then actually take your temperature. If the temperature is greater than 100.3, we will ask you to follow up with your primary healthcare provider. We will again confirm the questions that we asked before, that you had not had any of these conditions within the last 14 days. A temperature greater than 100.3, a cough, a sore throat, shortness of breath, flu-like symptoms, muscle aches, chills, tiredness, diarrhea, recent and abrupt change in smell or taste. And obviously, if you had had close contact with somebody who has been exposed to the COVID virus. At Penn Dental Medicine, your safety is paramount to us. We will protect your health using the most current guidelines available. We ask that you protect your health by following the best practices to protect yourself from getting the virus.